Hi, my name is Kristen Wells, and this is my presentation over recent trends in type 1 diabetes management. First, let's talk about what type 1 diabetes is and how it is prevalent in the United States. The majority of cases of type 1 diabetes are in children. It accounts for 5 to 10% of all diagnosed cases of diabetes. The peak incidence is in girls who are aged 10 to 12 and boys who are aged 12 to 14. Type 1 diabetes management is referred to as a pancreatic beta cell destruction and usually leads to absolute insulin deficiency. This means that the pancreas does not produce insulin and does not release it into the bloodstream in order to manage blood glucose levels. This is different than type 2 diabetes, which is referred to or associated with insulin resistance. This means that the pancreas still releases the insulin, but it is not effective in lowering blood glucose levels. At this time, there are no known means to prevent type 1 diabetes. This means that we should emphasize the management of diabetes in patients who have already been diagnosed with this disease. Before I start, I will go over the main 4 points in the management of diabetes that I have found and researched to be the most effective. The first is medical nutrition therapy and how to manage diabetes through diet modification. The second is medication and insulin therapy. The third is nutrition education and counseling. The fourth is psychological and behavioral strategies that help in the management of type 1 diabetes. So first, let's talk about medical nutrition therapy. Diet modification can directly influence blood glucose levels. Nutrient requirements for children with type 1 are similar to healthy children of the same age group. This is a new phenomenon or trend that has been studied where children with diabetes are not required or suggested to eat different foods than healthy individuals who are normal children. Children need a well-balanced diet with all micro and macronutrients. The new trends are using a food history of a typical daily intake to determine the child's energy needs instead of restricting intake. This means that the child can recall their diary of food and report to their parents what they would like to eat or what they have eaten, and they can track carbohydrates this way without restricting, because they have found when they restrict carbohydrate intake and energy intake in children with type 1 diabetes, they tend to feel deprived, and then they end up overeating, which results in a peak in blood glucose levels, which can be dangerous. This can lead to hospitalization or diabetic ketoacidosis. Recent studies show children and adolescents are successful at recalling only one meal at a time. Parents can work with their children to record morning and evening meals and snacks and request the child to recall the midday meal while at school. This practice allows for a joint effort between the parent and child in carbohydrate counting. So a parent or guardian can help with recording the morning meal, then the child can go to school and eat their lunch. And when the child comes home from school, they can report to their parents what they ate for lunch and amounts, hopefully, if they are of an adolescent age. And the parent or guardian can record this meal before giving the child a snack or the dinner meal. When they're given the snack or the dinner meal before recalling their lunch meal, it tends to be inaccurate. This approach is very beneficial in helping manage type 1 diabetes, but oftentimes diet management alone cannot keep blood glucose levels in a safe and healthy range. In this way, medication adjustments must be added with diet management in order to keep a diabetic patient healthy. An insulin regimen and sometimes medications are needed in order to aid in this blood glucose control. There is now a new FDA-approved fast-acting insulin on the market. It is called Afrezza. It may be hard to see this picture, but Afrezza is the first ever inhaled insulin. It works just like an inhaler does for asthma. It works when a patient inhales the insulin in a powdered form. It goes into the lungs and it is absorbed in the alveoli just like oxygen is when oxygen goes from the lungs into the blood. In the same way, the insulin will go from the lungs into the blood through that oxygen transfer. It is inhaled right before a meal and helps control blood glucose and A1C levels, and it is considered a fast-acting insulin. This can be very beneficial in children because it can be an easier way to administer insulin without skin pricking or shot injections. Insulin pairing with diet modification is the most effective way in improving lab values and a child's quality of life. So, after we have those two managed, it is also beneficial to have the child and parents be able to manage this diabetes on their own. The main goal of nutrition education and counseling is to establish a knowledge base in the patient in order to obtain self-management techniques. The Academy of Nutrition and Dietetics has termed this diabetes self-management education, and they abbreviate it DSME. This facilitates knowledge, skill, and ability needed for diabetes self-care. As a healthcare professional, we need to facilitate the educational session with open-ended questions that will allow the patient to guide the conversation and help them learn to manage their diabetes in areas that they want to work on most. Using the open-ended, patient-centered approach to education and counseling is a new trend in diabetes management. They have found that if you have the patient guide the conversation and guide the counseling session, they will be more inclined to remember everything from the session, and they will get out of the session what they want to learn. And if the patient is learning what they want to know from the education or counseling session, they are more likely to put it into practice. To help do this, the Academy has offered a manual called the Nutrition Care Manual. This is a paid subscription that most healthcare facilities and hospitals offer. I work at a hospital right now, and I know that we have this service at Hendrick Medical Center. It is available not only to the dietitians, but also the entire nursing staff. And to encourage this use of the Nutrition Care Manual, on Hendrick's homepage, they have put the Nutrition Care Manual under the Nursing tab so that nurses can easily access the Nutrition Care Manual to get educational resources for their patients. Patient-centered education has proven to have multiple benefits. It increases the effectiveness of education and improves chances of life application. It improves the health of individuals and populations as a whole. And it also reduces diabetes-associated per capita health care costs. It improves clinical outcomes, and it also improves psychological and behavioral aspects of dealing with this disease. In the same way, not only do we need medical nutrition therapy, medication and insulin regimens, nutrition education and counseling, but we also need to deal with the psychological and behavioral strategies that will help the patient manage living with this disease in their everyday life. The behavioral practices and strategies of the child is directly related to the practices of the parents. The parents have perceived difficulties in dealing with their child who is newly diagnosed with diabetes. These are often not addressed in a nutrition education or counseling session. One study done and published in the Journal of Academy of Nutrition and Dietetics shows some of these perceived difficulties of parents who have children with diabetes. Some of these perceived difficulties include belief that there are differences in a healthful diet for a child with or without type 1 diabetes, perceived significant barriers to healthful eating for children with type 1, and planned meals based on nutrition education they have received. Basically, this study is showing that parents are having a difficult time adjusting and knowing what is best for their child, and teaching parents that the behaviors and practices that they establish are examples that the child is going to adopt and also follow. And if the parent can set a good example, these children can learn to manage their diabetes at an earlier age and contribute to their overall health. Nutrition education of the parents is just as important as educating the child. The behavioral changes of the parent will directly influence the behavior strategies of the child when it comes to food. The way the parent perceives food is more than likely the way the child will perceive food as well. Benefits of psychological and behavioral strategies used in the management of diabetes include improved management of outcomes in children. As there is a low percentage of child that manage their diabetes in a healthy way, we need to increase this percentage of children who can manage their diabetes on their own. It can improve the health outcomes of the child and can increase likelihood of a longer lifespan. If they can manage from a younger age, their likelihood of living longer and their health decreasing at a slower rate will most likely occur. This management technique requires a healthcare team that can encourage behavioral changes that accompany clinical management. So we don't only need a dietitian, and we don't only need a doctor, but we need someone who goes with all of these disciplines. This includes pharmacists, doctors, registered dietitians, certified diabetes educators, nurses, psychologists, and a multiple of other healthcare professionals that I haven't even included. In this way, I have a personal story that can tie to this. My best friend's little sister was diagnosed with type 1 diabetes at the age of 9, so she was very close to being in that peak incidence stage. She was diagnosed and her parents did not have the best example of eating habits for their child. They struggled with the knowledge that they needed in order to help their child manage their diabetes. They struggled with this for a long time, and the child continued to go into the hospital and have ketone overload, diabetic ketoacidosis multiple times, and blood sugar that was off the charts. This was extremely sad and heartbreaking, and one day they just decided they had enough. And they went to a different doctor who emphasized the use of healthcare professionals in many disciplines. And she not only had a registered dietitian at that point, but also a certified diabetes educator. And both of these combined really made an impact on teaching the parents how to help the child manage diabetes. They were able to monitor her glucose through new technologies such as when the child checks her insulin, it sends a text to the mom at school when she's at school, and all kinds of awesome other management techniques that they received. This made a huge difference in the health of the child, and in the same way, we as a healthcare professionals can do this for many children who come in with type 1 diabetes. So in conclusion, there isn't just one simple way of dealing with diabetes. There are multiple facets to this, and it includes medical nutrition therapy, nutrition education and counseling, medication management, and also psychological and behavioral strategies. If we as a healthcare team can work together and use our resources to encourage the patient and help them meet the goals that they want to receive from the education and management and services that we have, it will help the patient better manage and have a longer lifespan. I hope you have enjoyed this presentation and learned a little bit more about the management of type 1 diabetes. Thank you.